Question 31. What would the nurse expect to see while assessing the growth of children during their school-age years? A. Decreasing amounts of body fat and muscle mass. B. Little change in body appearance from year to year. C. Progressive height increase of 4 inches each year. D. Yearly weight gain of about 5.5 pounds per year. Correct answer, D. Yearly weight gain of about 5.5 pounds per year. Question 31 Explanation. School-age children gain about 5.5 pounds each year and increase about 2 inches in height. Question 32. At a community health fair, the blood pressure of a 62-year-old client is 160/96ths of a millimeter of mercury. The client states my blood pressure is usually much lower. The nurse should tell the client to A. Go get a blood pressure check within the next 48 to 72 hours. B. Check blood pressure again in 2 months. C. See the healthcare provider immediately. D. Visit the healthcare provider within 1 week for a BP check. Correct answer, A. Go get a blood pressure check within the next 48 to 72 hours. Question 32 Explanation. The blood pressure reading is moderately high with a need to have it rechecked in a few days. The client states it is usually much lower. Thus a concern exists for complications such as stroke. However, immediate check by the provider of care is not warranted. Waiting 2 months or a week for follow-up is too long. Question 33. An 84-year-old male has been losing mobility and gaining weight over the last 2 months. The patient also has the heater running in his house 24 hours a day, even on warm days. Which of the following tests is most likely to be performed? A. FBC, full blood count. B. ECG, electrocardiogram. C. CT scan. D. Thyroid function tests. Correct answer, D. Thyroid function tests. Question 33 Explanation. Weight gain and poor temperature tolerance indicate something may be wrong with the thyroid function. Question 34. A nurse is administering blood to a patient who has a low hemoglobin count. The patient asks, how long do RBCs last in my body? The correct response is A. The lifespan of RBC is 45 days. B. The lifespan of RBC is 45 days. C. The lifespan of RBC is 90 days. D. The lifespan of RBC is 120 days. Correct answer, D. The lifespan of RBC is 120 days. Question 34 Explanation. Red blood cells have a lifespan of 120 in the body. Question 35. A mother is inquiring about her child's ability to potty train. Which of the following factors is the most important aspect of toilet training? A. The age of the child. B. The child's ability to understand instruction. C. The overall mental and physical abilities of the child. D. Frequent attempts with positive reinforcement. Correct answer, C. The overall mental and physical abilities of the child. Question 35 Explanation. Age is not the greatest factor in potty training. The overall mental and physical abilities of the child are the most important factor. Correct answer, C. The overall mental and physical abilities of the child. Question 35 Explanation. Age is not the greatest factor in potty training. The overall mental and physical abilities of the child are the most important factor. Correct answer, C. The overall mental and physical abilities of the child. Question 35 Explanation. Age is not the greatest factor in potty training. The overall mental and physical abilities of the child are the most important factor. Question 37. You are responsible for reviewing the nursing unit's refrigerator. Which of the following drug, if found inside the fridge, should be removed? A. Nadolol, Corguard. B. Opened, in use, Humulin N injection. C. Uracanase, Kinlytic. D. Epiton alpha 4, Epigen. Correct answer, A. Nadolol, Corguard. Question 37 Explanation. Nadolol, Corguard, is stored at room temperature between 59 to 86 degrees Fahrenheit, 15 and 30 degrees Celsius, away from heat, moisture, and light. Do not store in the bathroom and keep bottle tightly closed. Option B. Humulin N injection if unopened, not in use, is stored in the fridge and is used until the expiration date, or stored at room temperature and used within 31 days. If opened, in use, store the vial in a refrigerator or at room temperature and use within 31 days. Store the injection pen at room temperature. Do not refrigerate, and use within 14 days. Keep it in its original container protected from heat and light. Do not draw insulin from a vial into a syringe until you are ready to give an injection. Do not freeze insulin or store it near the cooling element in a refrigerator. Throw away any insulin that has been frozen. Option C, uracanase, kinlytic, is refrigerated at 2 to 8 degrees Celsius. Option D, epiton alpha 4, epigen, vials should be stored at 2 degrees Celsius to 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit. Do not freeze. Do not shake. Protect from light. Correct answer, A. Go get a blood pressure check within the next 48 to 72 hours. Question 32 explanation. The blood pressure reading is moderately high with a need to have it rechecked in a few days. The client states it is usually much lower. Thus a concern exists for complications such as stroke. However, correct answer, B. Contaminated food. Question 38 explanation. Hepatitis A is the only type that is transmitted by the fecal-oral route through contaminated food. Options A, C, and D, hepatitis B, C, and D are transmitted through infected bodily fluids. Question 39. A nurse is providing discharge information to a patient with peripheral vascular disease. Which of the following information should be included in instructions? A. Walk barefoot whenever possible. B. Use a heating pad to keep feet warm. C. Avoid crossing the legs. D. Use antibacterial ointment to treat skin lesions at risk of infection. Correct answer, C. Avoid crossing the legs. Question 39 explanation. Patients with peripheral vascular disease should avoid crossing the legs because this can impede blood flow. Option A. Walking barefoot is not advised, as foot protection is important to avoid trauma that may lead to serious infection. Option B. Heating pads can cause injury, which can also increase the risk of infection. Option D. Skin lesions at risk for infection should be examined and treated by a physician. Question 40. A patient is admitted to the same-day surgery unit for liver biopsy. Which of the following laboratory tests assesses coagulation? Select all that apply. Please select 3 correct answers. A. Partial thromboplastin time. B. Prothrombin time. C. Platelet count. D. Hemoglobin. Correct answer, A, B, C. A. Partial thromboplastin time. B. Prothrombin time. C. Platelet count. Question 40 explanation. Prothrombin time, partial thromboplastin time, and platelet count are all included in coagulation studies. Option D. The hemoglobin level, though important information prior to an invasive procedure like liver biopsy, does not assess coagulation. Question 41. The nurse is conducting nutrition counseling for a patient with cholecystitis. Which of the following information is important to communicate? A. The patient must maintain a low-calorie diet. B. The patient must maintain a high-protein/low carbohydrate diet. C. The patient should limit sweets and sugary drinks. D. The patient should limit fatty foods. Correct answer, D. The patient should limit fatty foods. Question 41 explanation. Cholecystitis, inflammation of the gallbladder, is most commonly caused by the presence of gallstones, which may block bile, necessary for fat absorption, from entering the intestines. Patients should decrease dietary fat by limiting foods like fatty meats, fried foods, and creamy desserts to avoid irritation of the gallbladder. Question 42. The nurse is assessing the client with a total knee replacement 2 hours post-operative. Which information requires notification of the doctor? A. Bleeding on the dressing is 3 cm in diameter. B. The client has a temperature of 100.6 degrees Fahrenheit. C. The client's hematocrit is 26%. D. The urinary output has been 60 during the last 2 hours. Correct answer, C. The client's hematocrit is 26%. Question 42 explanation. The client with a total knee replacement should be assessed for anemia. A hematocrit of 26% is extremely low and might require a blood transfusion. Options A. Bleeding of 2 cm on the dressing is not extreme. Circle and date and time the bleeding and monitor for changes in the client's status. Option B. A low-grade temperature is not unusual after surgery. Ensure that the client is well hydrated, and recheck the temperature in 1 hour. If the temperature is above 100.6 degrees Fahrenheit, 38.1 degrees Celsius, report this finding to the doctor. Tylenol will probably be ordered. Option D, voiding after surgery is also not uncommon and no need for concern. Question 43. The nurse knows that a 60-year-old female client's susceptibility to osteoporosis is most likely related to A. Lack of exercise. B. Hormonal disturbances. C. Lack of calcium. D. Genetic predisposition. Correct answer, B. Hormonal disturbances. Question 43 Explanation. After menopause, women lack hormones necessary to absorb and utilize calcium. Options A and C. Doing weight-bearing exercises and taking calcium supplements can help to prevent osteoporosis but are not causes. Option D. Body types that frequently experience osteoporosis are thin Caucasian females, but they are not most likely related to osteoporosis. Question 44. After the physician performs an amniotomy, the nurse's first action should be to assess the A. Degree of cervical dilation. B. Fetal heart tones. C. Client's vital signs. D. Client's level of discomfort. Correct answer, B. Fetal heart tones. Question 44 Explanation. When the membranes rupture, there is often a transient drop in the fetal heart tones. The heart tones should return to baseline quickly. Any alteration in fetal heart tones, such as bradycardia or tachycardia, should be reported. Options A, C, and D. After the fetal heart tones are assessed, the nurse should evaluate the cervical dilation, vital signs, and level of discomfort. Question 45. A client elects to have epidural anesthesia to relieve the discomfort of labor. Following the initiation of epidural anesthesia, the nurse should give priority to A. Checking for cervical dilation. B. Placing the client in a supine position. C. Checking the client's blood pressure. D. Obtaining a fetal heart rate. Correct answer, C. Checking the client's blood pressure. Question 45 Explanation. Following epidural anesthesia, the client should be checked for hypotension and signs of shock every 5 minutes for 15 minutes. Option A. The client can be checked for cervical dilation later after she is stable. Option B. The client should not be positioned supine because the anesthesia can move above the respiratory center and the client can stop breathing. Option D. Fetal heart tones should be assessed after the blood pressure is checked.